What's up, guys? Welcome back to UHP. Today I want to talk a bit about low back pain, more specifically some myths about low back pain, some misunderstandings about things. If you're like me and you work inside of a gym, have your clinic inside of a gym, always having people come up to you asking you about little injuries, some misinformation they may think about things that can hurt their backs, whether it's a lift, certain workout in the gym, or what they should do about it. A lot of times though, I'm dispelling a lot of these myths surrounding low back pain that a lot of people have heard or thought for a long time, and I've found in my career to not be usually the cause of these things. They may exacerbate them, and certain exercises may exacerbate your pain, make it worse, but may not necessarily be the origin of the problem. So we'll take these one by one and talk a little bit about each point and my thoughts on what is the true nature of a lot of the low back pain that I see as a clinician. First of all, strengthening back muscles will get rid of pain. This is probably the one that I hear about the most. Everybody wants just some exercise, whether it's core strengthening or hamstring strengthening, even the low back muscles themselves to get our extensors stronger, the ones that are attached to our spine. In my experience, these muscles themselves are typically not the problem. And so strengthening them, or simply strengthening them, a lot of the time will not just magically get rid of back pain, because more often than not, the issue is really a movement-based issue of our spine, not so much of some specific muscle that's been strained or injured in some way. So you can, do as many sit-ups or plank as long as you want to, or do as many bird dogs as you can possibly do, and it may not make a lot of issue on your back. It may not affect the back pain itself as much, unless you're doing something to specifically treat the back pain itself, which in my experience and in my training is a movement-based approach. So once we find like a directional preference of the spine, then we need to move it a lot typically. So doing a lot of strengthening exercises won't make a big difference if we're not also addressing the underlying issue. And then these things have their place after we've improved the range of motion or gotten rid of the pain in the back itself. Now, sort of the glue that holds that situation together going forward is these exercises, doing things like strengthening our core, making sure we know how to properly hip hinge and engage our glutes and brace our abdominal muscles, things like that. They do have their place, but simply doing those a lot of the time will not just magically get rid of the pain. Second thing, avoiding certain movements will get rid of pain. This is a big one I hear about in the gym, of course. People want to know what exercises they should avoid when their back hurts, or things they can just avoid and then hopefully their back gets better. Sort of the misunderstanding here is that people think if they avoid a certain lift, like say deadlift, for a big example is deadlift, because they know the bending over, the lifting heavier weight can pull them out of good position and hurt their back. So simply avoiding that lift for long enough will let their back heal. A lot of what I was saying about strengthening these muscles in our back, similar point, where if we don't identify movements or maybe hands-on techniques that are going to actually resolve the pain, just avoiding doing a certain lift or even moving in a certain way won't get rid of the pain. It may help it seem to go away, but then if you want to get back into these activities, it may resurface. The other thing is that most of the time it's not the stuff here in the gym, the working out, that is the problem. It's all of the sitting we do, it's all the bending forward we do, it's those lazy times on the couch where you're after you're home from work and you're sitting there for a couple hours watching TV. Those are the things that are really injuring our backs. And then we may go to the gym and lift, a deadlift or a clean, or pretty much any lift, even overhead lifting can also put our back in a bad position. Those things just expose it, because now we've tried to do something that maybe we're not really capable of, and we've just exposed the issue at hand, which a lot of times is that frequency of bending. We bend somewhere in the neighborhood of 2,000 to 3,000 times a day we bend forward. And that includes sitting and driving in the car and bending over to tie your shoes. All of those times are what really end up causing the problems of the back. And then, like I said, these exercises that we may want to avoid in the gym, just expose them. So really, we may need to avoid certain movements of the spine, like flexion, sometimes when we can, if someone responds to extension, but just simply avoiding certain exercises likely will not take care of the problem. And then the other big one that I talk about a lot of times with people, leg pain has to be of the leg origin, or the leg pain I'm feeling has to be because of a leg injury. Big things I hear about a lot are hip pain or hamstring pain going down the leg, things like that, where unless you have a very specific injury, like you were working out and you took off on a run and now you feel your hamstring, pain, cramping up, things like that, that points to a specific issue where it could be a problem in your leg causing that pain. But if you don't have any injury like that and you just notice that after you sit all day at your job and then you go up and start walking around, or you drive home from work and then you get out of the car after sitting all day, then your hips hurt in this area, or you're having pain down in the hamstring or even into the calf or the foot, that could be very suspicious from pain coming from your back, where now it makes sense that your back was in a bad position all day and you didn't get up and move around, and now your leg hurts. Well, it needs to be investigated to see if that pain in your leg is simply coming from the back. And sciatica, is a condition that a lot of people have heard of, but there's a lot of other ways that back issues at the back itself can cause radicular pain into the leg, meaning that the nerves are irritated. So there's a lot of things there that need to be investigated to find out, all this hamstring stretching or glute exercises you do for weeks, are they actually targeting the right thing? If that pain's coming from the back, you could do anything you want in the legs and that pain may stay there. And then lastly, I need an MRI to see what's going on. I've heard this statement in several different iterations, thousands of times over my career. Most of the time, 9 out of 10 people likely don't need an MRI or any advanced imaging of their spine just simply to see what's going on, for a lot of different reasons. One, it's a very expensive test. You're looking to spend thousands of dollars, if not your insurance is paying that kind of money, and you're paying a large deductible out of your pocket just to cover this picture, which is really all that it ends up being, a very advanced image of your spine. And if you're not in the medical field, you're probably looking at a result of your MRI, and if you're in your 30s, 40s, 50s, they're probably starting to mention things like degenerative changes in your spine that may or may not be related to your issue at all. Everyone, if they live long enough, are going to have degenerative changes, especially in the lumbar spine. That is one of the most common areas to see these things. And it starts to pop up in our 3rd, 4th, perhaps 5th decade. So, if you're in that age group and you go get an MRI done, you may see things like degenerative changes of your spine, you may see bulging discs at certain levels. It may not correspond to your pain. Also, you don't need the image to know what's going on as far as the pain, because the behavior of the pain is the important part. How does it respond when you're moving? An MRI, you're laying still the entire time. So it's a picture of your back with you laying flat on your back with no movement. That doesn't really seem like your normal activities of the day. You're up, you're walking, you're getting in and out of car, you're sitting, you're standing, you're exercising, you're running. How does the pain respond during those activities? That's what's important to someone like me. I need to know how the pain behaves based on what activity you're doing, because all of those things clue me into, is this something that can respond to mechanical therapy? Can we move your back in a certain way in order to improve that pain? And frankly, it may or may not make a big difference in my mind whether there's a small bulging disc in a certain place, whether there's degenerative disc disease, DDD, whether there's even stenosis at certain levels, whether they be in the central part of the spine or even at a foramina where our nerves go out to our legs. those things may not impact my thinking as much unless I'm seeing things that are not responding to mechanical therapy. So in most cases, an MRI, and even likely even an X-ray, which is much cheaper of an image, is not so necessary to figuring out, can this respond to mechanical therapy? So there's just a few myths that I hear about, I talk to people about a lot, whether I'm in the gym or in the clinic, just dispelling some of these myths and reassuring people a lot of the time that most of the time back pain is something that we can treat very effectively in the clinic without a bunch of invasive procedures, and take folks through a really thorough mechanical assessment and really see what's going on, see if we can improve that. So thanks a lot for watching the video. Click on some of these other videos if you have issues with your hip, with the shoulder.